how AI is reshaping healthcare. So a little bit about what we're going to get into today. We're starting with the basic role AI plays in healthcare and then moving into the main ways that it's being used right now. And after that, we'll cover some of the benefits and challenges that come with AI use and a few real industry examples. And then we'll finish up by looking at some future outlook. So in terms of the role of AI in healthcare, as of right now, AI in healthcare basically means we're using systems that can recognize patterns and make decisions based on past data. And even though it feels like a very new thing that we're dealing with, healthcare has actually used AI for years now. It really dated back in the late 90s and early 2000s when hospitals began digitizing their medical records. That made it way easier to track illnesses and find solutions faster. So as technology has improved over time, we see AI starting to help with things like analyzing images and assisting doctors with like medical diagnosis. Modern AI can detect signs of disease before symptoms can even show and read brain scans with double the accuracy of the human. So it can even estimate when a stroke happened, which really matters in choosing like right treatments for patients. So going into the key applications in healthcare, we put up a pie chart to see how hospitals are implementing their AI. So in terms of how AI is being used right now, the biggest area is medical imaging and x-raying. So about 40% of US hospitals are using AI tools to read x-ray scans, which is why that section takes up the largest part of the pie chart right here. We're also seeing a lot of growth in predictive analytics, which is around a combined 60% for things like spotting patterns and supporting clinical decisions. This chart breaks down to 30% for the lab results and lab data, and then 30% for the patient history. So overall, AI is helping with the everyday work in healthcare, just reducing administrative tasks and giving doctors and nurses more time to focus on their actual patient care.
AI offers a lot of benefits to the healthcare industry. For example, improved accuracy, better patient outcomes, and cost efficiency. AI can analyze vast amounts of medical data like imaging, scans, lab results, and patient histories much faster and a lot more accurately than humans can alone. It helps shift healthcare from reactive to a proactive model. By analyzing genetics and medical histories, AI can predict when patients are at higher risk for certain diseases and recommend early interventions. Beyond medical treatment, AI also reduces repetitive tasks for healthcare workers and helps hospitals use their time more effectively, which lowers overall costs. Repetitive tasks could be something like employee auditing for their files. It's a really time-consuming thing. Patients benefit as well since AI tools like virtual assistants and modern monitoring systems give them the necessary health information and support. Overall, it helps patients stay engaged and communicate with their providers. These benefits show that AI has the potential to improve many parts of the healthcare system. It can also both help patients and providers work together more effectively. As AI continues to advance, it will likely become an even more important part of delivering high-quality healthcare. Now we're going to look at some of the challenges and considerations with AI in healthcare. Systems rely on massive amounts of patient data to function effectively. This creates significant privacy concerns about how sensitive health information is collected, stored, and shared. The models are only as unbiased as the data they're trained on. If training data sets reflect historical inequalities like race or gender, the algorithms can perpetuate or even amplify those biases. The use of AI in healthcare presents several regulatory and policy changes that must be addressed in order to protect patients. According to one of our sources, one of the greatest difficulties with AI systems is that they continuously evolve, making it difficult for traditional frameworks to keep up. The article explains that while AI can greatly enhance diagnostic accuracy and efficiency, regulators must ensure that algorithms are transparent, validated for safety, and free from bias. Consistent standards must be made clear among healthcare providers to prevent problems from arising and to ensure safe, ethical healthcare practices. This case study describes an AI-supported remote healthcare device that allows patients to manage their medication from home. When the patient unlocks their medication using their thumb, the device automatically collects vital statistics, eliminating the need for the hospital itself to track their data. Upon dispensing the medication, the device monitors the patient's blood oxygen levels and heart rate. The information is sent through Galen data to the physician and can be accessed via a web application.
It also connects to the patient's phone through Bluetooth, so they can easily access their medical information. This assists doctors in deciding whether to adjust or continue with treatment plans and provide them with real-time updates. This system enables patients to remain in an at-home setting while receiving hospital skin treatment monitoring. This innovation is important because it expands access to high-quality care and reduces the need for in-person visits. And now, future outlook. Future healthcare professionals must understand how AI systems work, including their limitations and potential biases. Training should cover the basics of machine learning, algorithms, and predictive modeling. They should also cover data privacy, cybersecurity, and ethical handling of patient data. This foundation will help professionals critically evaluate AI recommendations rather than relying on them blindly. Experts predict that AI will definitely transform the healthcare industry, ultimately making it more effective and accessible. The main concern for AI in healthcare is how it's implemented. Healthcare organizations must prioritize strategy and ethical practices for this to be successful. According to the World Economic Forum, long-term success depends on not rushing implementation. In the future, AI is expected to enhance, not replace, healthcare professionals by supporting better decision-making and expanding access to care. In order for healthcare professionals to adapt to the changes that are occurring from AI integration, they will need new skills and knowledge sets. These skills and knowledge sets include data literacy, statistical and mathematical skills, and ethical standards.